I am Margot, and I'm one of the volunteers helping to coordinate with this year's event, especially for the History and Cultural Affairs. And we are just thrilled to have you all here with us. We just want to remind everyone that all of our events will be live streamed on the Zoom and then also on the YouTube channel. And you can access those at our website, adamsmorganday.com. We will also be streaming many events live on our various social channels. So check those out. You can also see them on Instagram and Facebook. We've got dancing, we've got music on Twitch, and also information about what's coming up on Instagram. And we also had fitness this morning also, so you can check those out too. Also want to encourage everyone, if you're up for it and in the area or neighborhood, to stop by our tent, which is at Marie Reed Elementary School. You can see some of the giveaways we have there and also a mural that is being painted live by some artists. So with that, just want to welcome everybody and pass it over to our amazing hosts from Hola Cultura and Mary's Center to share with us some information about this great new program they're hosting. So with that, Miriam, over to you.
Thank you so much, Margot, and thank you for having us in this this beautiful day. And thank you for the work that you guys, amazing work that you guys are doing, clearly do, especially during this difficult times. I am going to share my screen, and hopefully you'll be able to see this presentation. Hopefully technology will actually work. Okay, so you should be right now looking at a screen that says the community in times of COVID. Before I start, I would like to, thanks. I would like to welcome a couple of ladies that are here joining me. Moira Rogers, she is our new SPELL Educational Program Director. She just joined Hola Cultura last week, and she's here with us. As well as our special guest, Catherine Saavedra. Catherine, thank you so much for being with us. Catherine is a medical director of the Adams Morgan site for Mary's Center. And she is also a longtime Adams Morgan community resident. She's been in the neighborhood for 10 years and lives there with her husband and 2 kids. And we will be having a little bit later on a great conversation where Catherine has agreed to answer some questions, a list of questions that we have specifically related to COVID and the impact in our community. The way that this session will run, it's in, we have 3 parts. First, I will be sharing with you briefly our Hola Cultura's most recent and ongoing project related to the impact of COVID in our community and our community outreach. The second part would be our conversation with Catherine, where we will be touching on some key aspects of COVID and the impact in our community. And then the third part will allow obviously some time for any questions that you may have. Once again, thank you for everybody that's taking the time to join us this afternoon. And we truly hope that you'll be able to get some information out of this session that would be useful for you and your family as we go through this challenging times, but that I am sure that together we will definitely overcome. Before I talk a little bit about the current initiative and current project that I have, for those of you who may not be familiar with Hola Cultura, what you can see on the left side of the screen is Hola Cultura's mission. We build innovative pathways to success for the Latino community while fostering society's demands for the arts and humanities of Hispanic cultural initiatives. Hola Cultura is a DC volunteer-based organization. We've been working in the district for many years now. And what you have on the right-hand side are like the 3 most important or programmatic activities and program areas where we work in order to implement our mission. And I am going to pause one quick second. I can see there on the screen that we have been joined by Christine McDonald, who's a co-founder and executive director of Hola Cultura. Hi, Christine. Good to have you.
Hi, thank you. Thank you, Miriam. Thank you everyone for coming today. We're very happy about this partnership with Mary Center, and we hope that today's presentation and discussion will be helpful to everyone.
Thank you. So as I was saying, the three areas in which Hola Cultura works, we have in every work that we do, all the work that we do has an educational component to it. We provide through a educational platform, which is an educational and enrichment, after school enrichment program called SPELL. That is the short for storytelling program for experiential learning. We provide hands-on skills training for DC vulnerable youth. And the training that we provide through this program, and we can talk a little bit more later on if you have any questions specifically about the program, we basically focus on research, writing, critical thinking, and digital media. The second component, programmatic component that we have is the original content creation, which we publish in our olacultura.com, which act as not only our website, but also our digital journal. And we also do community outreach and civic engagement in the form of events, such as this one. The unique thing or interesting thing about one of the key interesting things about Hola Cultura is that not only these programmatic areas work in sync, but also that all of our content, one way or another, is generated, assisted, and coordinated by the same vulnerable youth that we are training. In other words, our hands-on training focuses on the creation of this content, original content, on the publishing side, and even on the event side and community outreach. Now, let me show you, basically, this is how it all sort of like works and is put together. And this is probably a good segue for me to show you how Hola Cultura works within the context, while at the same time also sharing this recent and current initiative that we're working on. So to give you a little bit of context, back in the spring, as we were conducting and implementing the spring session of the SPELL program, of the educational program, with a group of participants, that's when we were all hit with the pandemic. And at that time, just like everyone else, we were forced to take the program virtually. And when we were doing so, we started asking ourselves, how can we support the community as we go through this challenging times, while at the same time not drive away from our mission? And we, while doing that and brainstorming on that, we came up with sort of like we focus on two aspects. One aspect is that it was very clear that Hola Cultura throughout these years has been able to establish a pretty large and significant online community in the DC area. The other aspect that we were focusing on was the fact that we immediately noticed how the COVID-19 and the pandemic was affecting in a very disproportionate manner the Latino community, not only in DC, but all over. But we were focused at the time, we focused obviously on the district at a particular time. And in addition to that disproportionate impact, we also noticed that there was a gap for information in Spanish. There was sort of like this gap between the information and the reliability on the information that Spanish-speaking residents were being able to access. So looking into all those aspects, we reached out to Mary Center, and we're very happy that they agreed to partner with us. And we conceptualized and created this initiative that eventually we pitched to the DC Mayor's Office of Community Affairs. And we're lucky to be selected as one of the 77 organizations under the DC Hope Community Grant to be able to implement what is currently the project called the DC Latino This is Latino Community Hope, improving information access and care. So this project has basically three major components. One of them is we assign funding for the purchase of protective personal equipment for frontline workers at Mary's Center. The second component is we assign funding and dedicate some of the funding to increase the access to services, not only to Latino families, but to DC families in general, serviced by Mary's Center. And then the third component, which is the largest of this specific initiative, is an information and outreach campaign that I want to just talk briefly about. When I was referring earlier on as to how in everything that Olacultura does, our vulnerable youth that go through our educational programs, they become part of the content and the efforts and the implementation of projects that Olacultura does for the community. And this is no different for this specific project. So for this information and outreach component of the project has sort of like three different parts. The one part is that Olacultura for 6 months is creating, not only creating content and information that is useful for the community, but it's also using and sharing information in Spanish for Spanish-speaking residents of the district, and using its online platform to share and spread the word. That's one of the components of this information campaign. The second component, and something that we're currently working on, and that we hope to have ready for the first week of October, is we are creating and developing a directory of resources, available resources in Spanish. This directory is going to be a list, a compilation of a list of sources, both basically organizations that provide information in Spanish to residents and related to COVID-19. The directory is going to be organized in three ways. One section will provide links to reliable sources that provide general information about COVID and the pandemic, both at the local level, meaning DC, as well as the federal level. The second part of the directory will list organizations in the district that are providing services to the community in Spanish, all different types of social services. And then the third component of the directory will be to list sources of available sources for virtual entertainment. Obviously, besides Netflix, there are many sources providing different types of virtual entertainment these days, ranging from museums or galleries and so forth. This directory will be published both digitally and also printed. The printed copies will be available at Mary's Centers, and the digital version will be shared. Will be obviously housed in Olacultura's digital journal, but also shared throughout our blogs and social media platforms. The third component is a series of what we called COVID-19 Monthly Bilingual Series, where our SPELL participants, guided by their mentors and their fellows, are conducting monthly interviews of experts from Mary's Center, and are based on those interviews, are taking those interviews and are turning them into stories, both in English and Spanish, that are being published in our digital journal, as well as shared in our social media platforms. We have already completed 2 interviews with 2 of the experts from Mary's Centers, one for the month of July, the other one for the month of August. And the topics range from mental health to vaccines and how to take care of children during the pandemic and so forth. It's if you have not seen these stories, please feel free to access them through our Olacultura.com site. And this is a fantastic segue for me to once again welcome Catherine and to our session. And we would like to, Catherine, thank you so much for agreeing to answer some of the questions that we have related to COVID-19 and the impact in the pandemic. And as I mentioned before, for those of you who probably joined us a little late, Catherine Saavedra, she's the medical director of the Adam Morgan site for Mary's Center. And Catherine has been, grew up in the Washington, D.C. metropolitan area and has been a member of, a resident of the Adams Morgan community for 10 years now, with her husband and her 2 kids. So welcome, Catherine.
Thank you, Miriam. Thank you so much for having me.
Catherine, I would like to start by asking you, what are some of the most significant ways that COVID-19 has impacted our community?
Yeah, the COVID-19 pandemic has affected everyone in our community in different ways, like individual illness, losing jobs, businesses and schools closing, depression, stress. It's been a difficult time for everyone in our community. Unfortunately, the virus has disproportionately infected the Latinx community or communities of color, particularly people who work essential jobs, who may not have had paid leave or the ability to work from home, people who live in high density housing, or people with chronic medical problems. As medical providers at Mary Center, we've watched our patients get sicker at higher rates and with more complications than the rest of the community. And even now, as things are calming down a little bit, we see those disparities continuing. Some people, unfortunately, are now showing long-term health complications related to their COVID-19 infection, and we're still kind of learning about that and figuring out the best way to treat it.
Yeah, definitely. Thank you. You know, one thing that we've been hearing a lot of talk, not only lately, but I believe that, you know, it has probably taken more speed lately, is this issue about herd immunity. And if you could just share with us, you know, what exactly is herd immunity, and does that automatically means that once we achieve herd immunity, everything goes back to miraculously to normal, and that we don't necessarily have to follow social distancing anymore?
Yeah, it's a great question. Herd immunity is the concept that once enough people in our community have immunity to an infection, then it will stop spreading naturally or slow down significantly. And the percentage of people in a community that need this immunity in order for it to work, it really varies based on the virus and how contagious the virus is. And so there are some estimates coming out that 70 to 80% of the population would need to have immunity to COVID-19 in order for it to stop spreading naturally through the community. And most likely that will only happen once there's an effective vaccine.
So we must continue with social distancing for sure.
Right. Yeah.
Thank you. You know, this is my next question. It was actually something that I've been discussing with my daughter over and over again, who luckily has recovered from COVID 2.5 weeks ago. And it's something that, you know, we continue to sort of like talk to each other about. And it's this issue of immunity after you have had COVID-19. So my question is, can you talk a little bit about, you know, are we immune to the virus after we have COVID? Or is it still important to continue to practice social distancing guidelines?
Yeah, so some people are shown to develop antibodies to COVID-19 after they've had the infection, which what it means is that their bodies have developed an immune response to the virus. What we don't know is how long this immune response lasts and whether it gives you long-term immunity or not. And unfortunately, more and more studies are showing that it may only last a few months, kind of like the seasonal flu, how that kind of comes around every year. So it's still really important to follow social distancing guidelines to prevent reinfection or maybe carry the infection to other people. And it's hard to predict who will develop serious illness from contracting COVID-19. And so for that reason, like really important to stay home and keep following social distancing guidelines if you believe you've been exposed or have symptoms.
Thank you. Yes, I've been telling my daughter, just make the assumption that you've never had it, and continue to practice social distancing. So lately, we've all of us who are parents have seen, and are going through sort of like the challenging of, schools opening, and what do we do with the kids, or what do we do ourselves, if not the kids, in terms of sort of like preventive medicine and, our annual checkups and so forth. What advice would you give parents regarding children's vaccinations against other illnesses during this pandemic? And how important is it that, they maintain their vaccination schedules current?
Yeah, it's extremely important that even despite this COVID-19 pandemic, that we continue to have preventative care visits for all ages, kids and adults. For adults, this means annual checkups and maybe certain cancer screenings. And for children, it means child checks and staying on the vaccine schedule for other vaccine preventable illnesses. This is important just to stay healthy, prevent other illnesses, identify any medical problems or developmental problems early, and prevent any chronic issues from getting worse during this time.
Great. As a matter of fact, I am getting my annual checkup tomorrow. So, so yes. So everybody should join me, and let's do this. Let's stay current.
Yeah.
If we can move on to the sort of like the COVID test and the available tests today, can you briefly describe the two different types of tests that exist currently, and when would you advise someone to get one versus getting the other?
Sure. So the two major categories of COVID-19 tests are the molecular category, which is when they take a swab of your nose or a swab of your throat, and then the serology or antibody test, which is a blood test. So the molecular test, which in the gold standard is the PCR test, it can detect the presence of an active COVID-19 infection by finding the viral proteins in your nose or throat. Sometimes it can even detect the virus before symptoms start, and it also sometimes remains positive for a while after the person's been infected. So I would say this test should be done if you believe you've had an exposure to someone with COVID-19, if you have any symptoms which may be concerning for COVID-19, like fever, chills, cough, body aches, nasal congestion, diarrhea, vomiting, or just to continue testing yourself occasionally to make sure you're not an asymptomatic carrier, meaning that you've been infected but feel fine and could spread the virus to other people. The blood test or antibody test can only detect if someone has had an immune response to COVID-19 virus rather than the active virus itself. So it signifies that maybe someone had a prior infection of COVID-19 or acquired immunity, like as in if they got a vaccine, once we have a vaccine, hopefully. This test should not be used to diagnose an active COVID-19 infection, since there's no way to gauge how long ago the antibodies developed. And it's not really known how long antibodies remain positive after someone recovers from COVID-19. There's also the possibility of false negatives and false positives in both of these tests for various reasons. So just something to keep in mind.
Yes, it is definitely it gets a little bit complicated. So one of the things that probably, and I'm sure everybody can relate to me in this aspect, is I don't know how many times since the pandemic started that I have been convinced or have convinced myself that I was having COVID. And The latest one was a couple of weeks ago when I could have sworn that I was having shortness of breath, that I was having difficulty breathing, that I was feeling a little bit confused, when in the end it ended up being sort of like a panic attack and an anxiety attack, and which clearly shows sort of like the stressful times and the impact that this pandemic and COVID is placing on our mental health. Could you recommend ways that we can look after our mental health during this stressful time? And why is that so important?
Yeah, thank you for saying that, because it's so common what you're describing. It's happening to everyone. These are stressful and really unprecedented times, and many people are experiencing higher levels of anxiety and depression and trauma as a result of living through this pandemic. And whether it's due to losing your job or worrying about the health of your daughter or your family or friends, experiencing systemic racism and unrest in our country right now. I mean, these current times are affecting everyone in our community. So to care for your mental health is extremely important, just as important as caring for your physical health and body. Small ways to do this, I think, are maybe daily exercise or a walk, taking time for yourself, focusing on a hobby or something that brings you joy, and just trying to focus on things that you can control, because so much of what's going on is really out of our hands. And I think if you still feel that things are overwhelming or find depression, anxiety, panic interfering with your life, that talking to a mental health therapist or your primary care provider about coping mechanisms and different treatment options is really, really important.
Great, thank you. Weather like today reminds us of, the beginning of the fall, which is a beautiful season, while at the same time, it could be pretty intimidating, thinking that, the flu season is ahead of us as well. Could you share some advice with the community regarding the upcoming flu season?
Yeah. The upcoming flu season is definitely concerning for all of us. It's been on our minds and at Mary Center, and trying to figure out how to get flu vaccines to everyone. It's really important to get your flu vaccine, especially this year. Continue social distancing, wear a mask when you're in public, wash your hands as often as you can. Throughout the whole fall and winter flu season, to prevent further disease spread. The seasonal flu has pretty much identical symptoms to COVID-19. And so it's going to be really challenging to tell the difference between these two viruses, and could lead to worse outbreaks of both potentially. So we're definitely encourage people to get their flu vaccine this year.
Great, thank you. How can Mary Center help our community during the pandemic?
Absolutely. We have stayed open to our participants throughout the COVID-19 pandemic and have adapted our services in every way possible to continue being there for our patients and participants. So we provide comprehensive medical care, like primary care for children, adults, elderly, pregnant women, prenatal care. We have behavioral health therapists, dental services. We are offering both in-person visits and virtual visits through telemedicine. We have telemedicine for our primary care providers, our dentists, and our therapists as well. And when we see people in person, we do a thorough symptom check at the door to make sure that everyone who's coming in for Well Clinic services does not have any symptoms of COVID-19 or any potential exposure to COVID-19, so that we can keep our clinic as healthy as possible. We also additionally do have COVID-19 testing and treatment capabilities for kids and adults. And this is an area that we keep separate from our Well Clinic. And we can even do it outside in a tent or testing in your car to try to keep everybody as healthy as possible. Mary Center also offers amazing social services like nutrition, access to housing and food programs, financial assistance or assistance enrolling in health insurance, education, employment and legal service referrals, things like that. So pretty much almost anything.
Great, thank you. Any other final recommendation for our community members, Catherine?
Sure. I mean, I just think if we can all keep working together and persist, I feel that at this point in the pandemic, it's becoming a little bit more like everyone's a little more fatigued with it, right? At first it was different and we all felt like we could get through it, and then it's becoming a marathon. And so I think if we can just keep working together as a community, prioritize our health and wellness, mental health and physical health, we can get through this together and support each other.
Great. Thank you so much, Catherine. Once again, I think for myself and on behalf of Hola Cultura, we truly appreciate the partnership that we have. We are learning and will continue to learn a lot more as time goes by. And we are really lucky to have you guys be working with us to try to support the community as we all go through this together, as you say. So once again, I really thank you and appreciate the time that you've taken with us here today.
Thank you, Miriam. It's a pleasure to work with you and Olacultura as well. So thank you.
Thank you. And I would like to just share with everyone, with all the participants, this is our contact information at Hola Cultura, our email, holaculturadc@gmail.com, telephone number 202-696-9642. And again, our website and digital journal, olacultura.com, is available. We have great original content. And I would like to now pause and take any question. I will stop sharing my screen and see if anybody has any question for either one of us. Okay. Let's see.
Hi folks, this is Margot. Just everybody who's on here for Zoom, you can either write your question in the chat or also raise your hand and we can unmute you. And for those joining us on YouTube, you can add in a question to the live chat there as well. Just getting a lot of positive feedback right now, which is always great and welcome. Thank you, everybody. And thank you also, Miriam and Catherine. That was really excellent to hear all this amazing work and thought that's being put into this for our neighborhood community. I just wondered, maybe Miriam, if we don't have any questions while we're waiting right now, if you wanted to share a bit more about the keepsake, actually, maybe that we developed and is also available online right now. And if we get some questions, we can come back to those.
Absolutely. Last year, and thank you, Margot. Last year, we worked with the DC Oral History Collaborative and created and developed a keepsake, both in English and Spanish, that basically chronicles the history of the Latino community in the Adams Morgan neighborhood. And this keepsake this year, and actually for or using the Adams Morgan Day festivities as a sort of like prompted us to turn the keepsake from a printed document into a digital document. It is available in the Adams Morgan site. It is available in Olacultura site as well. I encourage everyone, if you haven't seen it, it is interactive. It's basically told by members of the community. And once again, this was one of those projects, like everything that we do at Olacultura, where our youth were the ones conducting the interviews of all the community members. They helped in putting the stories together. They helped in creating the videos that are part of this keepsake. So I really encourage everyone, and as I said, it's both available in English and Spanish. Some of the hard copies, for those of you who will be participating in some of the live activities down there at Adams Morgan, stop by the table. I believe that some of the printouts are available there. And again, for those of you who are home, feel free to check out the digital version. I would like to also take an opportunity to just a couple of just very quick announcements. Our SPELL program, educational program, will start. The fall session is starting on September 22nd, and it will run through December 15th. We are currently recruiting participants. The sessions, the workshops will be carried out every Tuesday from 5 to 7 p.m. Obviously, for this fall, we are going to remain virtual. And all we require from the participants is, in addition to the weekly workshops, is 60 to 90 minutes of assignment time outside from home or outside of the program. We only have space for 15 participants, and they need to be between the ages of 15 and 25. We have online application in both English and Spanish, and if you have any questions or you're interested, we have an information email. Is spell SPELHC from Olacultura @gmail.com. The second thing that I would like to say is stay tuned for our upcoming interview on our COVID-19 bilingual series of another one of our experts, partners from Mary's Center. And this story should come out within the next couple of weeks. And finally, the directory that I mentioned will be, we're hoping to have the full directory launch during the first week of October. Printed copies will be available at Mary's Centers, and the digital copy will be, the digital version will be in our holacultura.com site, and we'll be sharing it throughout our social media platforms as well. Thank you. Christine, not sure if you would like to say a few words while we wait to see if anyone has any other questions.
Well, thank you everyone for coming today. I think the presentation was excellent and the information was very helpful. Thank you, Miriam, and also Catherine for providing all of this information to us. And we are very excited about the Fall Spell program. So if anybody does know, a young person who could benefit from this experience, we really do think that this experiential learning is a great way for people to improve on their professional skills. So please help us spread the word. And thank you very much for, I hope everyone has a wonderful virtual Adams Morgan Day. It looks like there's some fantastic other programming as well. So we're very happy to be part of it. Thank you to Adams Morgan Day organizers, Margot, and the rest of your team who have made it very smooth for us, and Miriam, who really took the lead and on this whole presentation. So thank you very much, Miriam.
No, thank you. It's been a pleasure. And Margot, thank you so much. I really, and for all of you out there, I hope that, just stay safe, stay healthy, be outdoors if you can. It's important to get some fresh air, especially in a day like today, and enjoy the rest of the activities that Adams Morgan has put together.
Thank you all so much.
Thank you, Margot.
Yeah, thank you so much, everyone. We really, really appreciate you joining on. And since we don't see any questions, I think we could just wrap this up. It's been so great. And since you mentioned, perhaps if you're feeling, safe to go outside, don't forget that we have a few activities in person today. Over by Kalorama Park, we have the American University Humanities Truck. They're sharing, like Miriam said, the different keepsakes, but also some information from the neighborhood about the history, and also a special audio tour that you can participate in via your phone at a nice safe distance, and sit in a park bench and listen to some information about Kalorama Park. We also have the live mural painting going on at Murray Reed, which is really fabulous. and also the tent at Marie Reed for Adams Morgan Day. And don't forget, we have a few more sessions today around history and cultural issues. Our next up at 2 o'clock is the Backstage Adams Morgan event that will showcase music venues from the past and today and looking towards the next generation. Then we have art and activism, which is including some of the muralists that are at Marie Reed, as well as muralists who have been involved, especially recently, in creating pieces in Adams Morgan that were created around the uprising and protests around George Floyd's death and other deaths as well. And also particularly maybe to the Latinx community, the piece at El Tamarindo, which was created in honor of, or in tribute to Vanessa Guillen's tragic death and the violence towards her. And then we have a couple of interesting sessions at 4, 5, and 6 on local politics, also the history of punk in our nation's capital, particularly in Adams Morgan with those filmmakers. And then wrapping up with a really exciting conversation with a lot of Latin community activists who are in the next generation, and looking forward to hearing from them how they're keeping the culture alive in Adams Morgan. So with that, I think I would just like to thank you all, and again, the support of Olacultura for making this happen, and all the other pieces with the keepsake as well. And we will be in touch with all of you, and please chime in with any last minute questions. Otherwise, we'll see you at the next event.
Thank you, Margot.
Thank you again.
Thanks, everyone.
Thank you.
Have a great day.
Thank you.
Well done. Bravo.
It was nice to work with you guys. Thank you.
Thanks for coming. We're very happy about this. We should see what else we can do.
Yeah, that would be great.
Yeah. Thanks for coming and being part of it.
Yeah,
I think we're gonna probably publish your answers. We on Hola Cultura this week, just for people who weren't here, and so I just